Panel of medical experts unanimously recommended Moderna booster shots for many of those who had received the company's vaccine.
WGN's Dana Rebick is joining us now with the details. Dana.
Well, after the Pfizer booster was approved last month, many were expecting this news today, a recommendation for a third Moderna shot for a similar population of people.
We do have a unanimous 19 out of 19 yes votes.
Today, a panel of advisors to the FDA recommended emergency use authorization of a Moderna COVID-19 booster shot. The half dose would come at least 6 months after a second dose of the vaccine. Those 65 and older would qualify, as well as people 18 to 64 who have underlying health conditions or work in high-risk settings.
It definitely will boost the immunity. The results of the study show very clearly that their antibody levels go up substantially.
Moderna said it chose the lower 50 microgram half dose for a booster because it reduced side effects like fever and achiness and left more vaccine supply available globally. But not everyone taking part in the FDA panel today was supportive.
So I don't necessarily see the need for a sort of let it rip campaign for boosters for everyone who's ever been vaccinated.
I just think that we continue to send wrong messages out there by using terms like breakthrough and by making people feel that they're not protected unless they've gotten a third dose.
Tomorrow, this FDA panel will discuss the Johnson & Johnson vaccine, including data on giving a Pfizer or Moderna booster for those who got the J&J shot.
The mixing and matching is a common strategy in vaccinology, actually. We call it heterologous boosting, where you use two different vaccines. It makes a lot of sense to do that because you're showing the immune system something a little different.
Health experts say the timing of administering boosters could potentially help thwart a spike over the winter.
We're getting into the flu season. There's fear that we'll get a rise in flu at the same time that there might be a resurgence of coronavirus, so we want to protect against that as much as possible.
The FDA will weigh the recommendation before making a final decision. Then next week, the CDC will convene a panel to discuss. The CDC director would ultimately sign off on this. And Dr. Richard Novak, who we spoke with tonight from UIC Health, says he thinks this could all move very quickly, that we will be hearing something early next week on this.
That is quick. Okay, thank you so much, Dana.